Good evening and welcome to our webinar. So I'm going to go ahead and get us started. Thank you so much to those who have joined us. This webinar is focusing on our Master's in Bioethics and Medical Humanities program here at Case Western Reserve University. And we're really going to be diving in and focusing on clinical ethics today, specifically our clinical ethics rotations that students can participate in. So I am Dr. Leah Jeunnette. I'm the director of our Master's in Bioethics and Medical Humanities program, and I'm also the Associate Director of Educational Programs regarding bioethics and medical humanities in the Department of Bioethics. I am also a clinical ethicist at university hospitals, and I'm also an alum of the master's program. I graduated in 2009. So I'm just going to do a quick overview of Case Western Reserve University and the School of Medicine, and then we're going to dive into a clinical ethics discussion. I'm going to present a case and just kind of highlight, the ethical considerations we think about cases like the one I'm presenting. We'll talk about the MA program, go over overview of that, and student opportunities within focusing on clinical ethics, and talk quickly about application and financial aid, and then leave time for Q&A at the end. So if you do have a question and you're here live with us, you're welcome to submit here using the Q&A button, or if you see the ellipses, it'll take you to the Q&A and submit a question. Or if you're interested, you're welcome to email us, bioethics@case.edu, and I will get back to you in response to your question as well. I will save the questions to the end, but feel free to submit them anytime during the presentation. So Case Western Reserve University is located in Cleveland, Ohio. We are considered an R01 research university. It's a great campus that's spread out in what we call University Circle. Our School of Medicine is particularly known for its medical education and research. We are considered #1 in Ohio and considered a top tier medical school in the United States. In terms of research funding, we are #7 in the US and #22 in the world, according to the Leiden Impact Rankings. And then the Blue Ridge Institute for Medical Research ranks us #26 for NIH funding. We are also very honored that Time Magazine named us in the top universities in the world, and Forbes magazine recently named Case Western Reserve University as part of the quote new Ivies, which is very exciting. And so I highlight those statistics simply to say that we are a university that has a lot of opportunities, a lot of research going on that our students are engaged in as well. So I'm going to shift gears just a little bit and focus on clinical ethics. So what is clinical ethics? And beyond the answer of its ethics in the clinical setting, it really has a variety of topics. And so from a topic standpoint, clinical ethics thinks about things like do not resuscitate orders, advanced directives, decision-making and capacity, organ donation, the interplay of religious and cultural values in decision making, things like non-beneficial treatment, allocation of resources. All of that goes into clinical ethics. And really, when there is a clinical ethics issue present, as you'll see in the case we're going to talk about, it doesn't mean that there's necessarily a quote right or wrong answer, but rather there is a conflict of values by the stakeholders involved in a given case. So Dr. Mark Alicio is the chair of our bioethics department here at Case Western Reserve. And in 2003, he wrote this wonderful article about a hypothetical case called the multi-talented motorcyclist. And the idea of this case is you have someone who is on their motorcycle and gets into an accident and is taken to the emergency department. And the patient has some pretty significant leg injuries as part of the accident. And the team is recommending that they take some tendons and some muscles and ligaments from his wrist to move into his ankles and knees and such. And the goal is to save his leg. If they don't do these types of interventions, there is a high likelihood that the patient will actually lose their leg due to amputation. And the patient is asked, this through an informed consent process. And in the discussion, the patient is adamant that does not want this surgery. He is comfortable with losing his leg, but he wants his hands to remain fully intact. And this upsets a lot of the clinicians. And what we think about with this case is what is the why of a patient refusing a surgery that would save his leg? To most people, the importance of a limb is recognized, not to say that there aren't wonderful prosthetics and ways that an amputation can be addressed medically and socially. But I would say to the average person, it seems unusual to refuse such a surgery and be willing to lose your leg, or for the patient to lose their leg. In this case, though, when you dive into the patient's values, what you learn in talking to the patient more is that they're actually a concert pianist, and having full functionality of his fingers, his hands, his wrist, his arms, his elbows is the most important value to him. Because if he loses that ability, for him, that is part of his identity. And once we learn that additional piece of information, our perspective may change on his refusal of the surgery on his hands and legs. And all of this goes to show you that the values that a patient brings to the table may or may not match up with that of the clinicians. And this is where we have this, what I said before, a conflict of values. And so what this case is demonstrating is that in the world of bioethics and medical humanities, we consider the complex value-laden issues that emerge in delivery and practice of biomedicine and life science. So in this case, for this patient, his part of his identity and value was being a concert pianist and being able to do that work and that art form, and to the point where he was willing to lose his leg over it. And for him, that was really important. I would say a second point is one way of defining bioethics and medical humanities is that it is the practice of working to identify, analyze, and resolve these value conflicts or uncertainties that emerge in these above areas. So in a case like this, it wouldn't be that unusual for a medical team to reach out to a clinical ethicist or the ethics committee and say, hey, we have concerns that a patient is refusing a surgery that would save his leg. He is opting to take the risk of amputation. And that may make the medical team uncomfortable. They may be experiencing moral distress because their values and the values of the patient are not identical. And then lastly, I'd say it's important to study various approaches to bioethics and medical humanities because each approach has the potential to offer a different perspective or surface a different aspect of the complex value-laden issue under consideration. The idea of viewing it through different lenses. So while the team may be uncomfortable with the patient's decision, if the patient has capacity, he is put through the informed consent process, meaning he understands the risks and benefits of the surgery, of refusing the surgery. He understands the consequences of either accepting or consenting and refusing the surgery. He understands all of those things, is able to communicate it back. And it is a reasonable decision to refuse such surgery. Then we as clinicians or as part of the medical team have to respect the patient's autonomy in this case. You may approach it with other values though. And so in this case, the value of autonomy is very important, but also providing benefit to the patient, meaning he will still live a full life even with an amputation. But in this case, the value for him, the benefit is to keep his ability to play the piano. So given that kind of very simplistic example of a clinical ethics case, I think it's pretty easy to see why studying something like bioethics and medical humanities is important. Ultimately, healthcare impacts all of us, whether it's our own medical interventions or healthcare or health choices, or those that of loved ones. It impacts us all. There is decisions to be made. There is involvement with health. And because we have constant advancements in medicine, science, technology that can lead to big questions, really that concern us ethically and as individual humans. And so we think about big questions like, should we intervene? What kind of values should inform policy or practice? Can we, and frankly, should we ensure justice and respect for persons in clinical and research practice? And these are just examples of some of the big questions that get asked when we think about bioethics and medical humanities. In clinical ethics, we're really thinking about an applied version of this where you have real patients and real cases in hospitals, in outpatient settings, as it relates to individual patients and medical teams. So ultimately, then, how does bioethics and medical humanities assist a student's career path? So, the fields of bioethics and medical humanities are incredibly interprofessional and they're also multidisciplinary. So, those who are in these fields come from all different backgrounds, demographically, educationally, geographically. And because of that, we bring different expertise, different insights, and different understandings to the table for these discussions. So ultimately, because of that interprofessional nature and multidisciplinary study, this is an opportunity to launch students into professional careers and a multitude of directions. So when students join our master's program, we have students who their goal, their career goal is to go to medical school, but not all students are pre-med or pre-health. Perhaps they're going to go into legal professions like going to law school and becoming a lawyer or working in health policy or regulations. Perhaps a student goes into arts and humanities, or they become full-time bioethicists or clinical ethicists like myself. Or maybe they go into academia and conduct research. Maybe they're working in the public sphere, and so they're working in public health or social work in the community. And then we always have a segment of students who are searching for discernment, meaning they have an interest in health or healthcare, but they're not 100% committed to a career path, or they're uncertain of the career path they've been heading towards. And a program like this really will give students the opportunity to explore. So let's talk a little bit more about the master's program specifically. We are the oldest master's in bioethics program in the country. In 2017, we formally added the and medical humanities to the title of the degree. So this upcoming fall, we will be celebrating 31 years of our master's program at Case Western Reserve. If a student is interested in doing our program full time, it's done in one academic year, meaning students will start in August and graduate in May, so 2 semesters. Our curriculum allows for customization, so there are 30 credits total that students need to complete. Most students complete 15 credits in the fall, 15 credits in the spring. Over that time, there is some required courses and some elective options for students. We do have the opportunity for 160 hours of clinical ethics rotations, I'll talk about in a little bit, as well as short-term study abroad courses for 3 credits. And our program does allow for concentrations. So by default, all students are in our what we call the traditional program, meaning there's no concentration requirement. But students could do a concentration in research ethics, medicine, society, and culture, or health policy. All students have personalized advising in our program, meaning there's an academic advisor to work with you to determine your career goals, your program goals, your electives, and such. And then we also have dual degree options. If you're interested in learning more about those, feel free to email me. So in terms of our curriculum, all of our students take a course called Foundations in Bioethics and Medical Humanities 1, and then Foundations 2 in the spring. We have our first semester of clinical ethics rotations and a bioethics and medical humanities capstone. And so those 4 courses are required for every student in the master's program. Then, depending on if you have a concentration or not, we have electives, and in some cases, there are certain courses that is designated to match that concentration. So I would say for students who are specifically interested in clinical ethics, most commonly, they're going to be interested in what I would call the traditional program. And so in addition to our core courses, they will have several electives. They have 1, 2, 3, 4, 3-credit electives, as well as a mini elective for 1.5 credits. And they will complete a second semester of rotations. So, what does it mean to choose an elective that focuses in bioethics or clinical ethics specifically? So, we do have a specific elective called Clinical Ethics Theory and Practice, taught by Dr. Mark Alicio, and it really allows you to dive into the nuances of clinical ethics, both in theory, meaning in the academic sense, what is the literature saying, but also in practice and how we do clinical ethics in a hospital or at the bedside with patients. Other electives that do have clinical ethics elements to them include things like mental health ethics, disability bioethics, health policy, death and dying, neuroethics, pain management, bioethics in correctional settings, or queer bioethics. And that's just a small segment. In addition, as I mentioned, we have our study abroad courses. And then there are electives that can be taken outside of the department as well, that can have some overlap with clinical ethics, like health policy out of the law school, for instance, or health law out of the law school. And then, of course, there's research opportunities for students. Sometimes our clinical ethicists at the hospitals that also teach in our program are looking for research assistants or looking for someone to join a research project. And so that opportunity can also come up for students. So in terms of our clinical ethics rotations, at minimum, all students complete 80 hours of rotations in their first semester. And if they're doing a second semester of rotations, which most students do, they will leave the program with 160 hours of clinical experience. And what that means is students are assigned a specific hospital in the fall semester and a different hospital in the spring semester. We have 4 teaching hospitals here in Cleveland. Um, 2 private hospitals, either university hospitals or Cleveland Clinic, 2 public hospitals, MetroHealth or the Cleveland VA. And the goal is to get students to experience 1 public, 1 private hospital. So when you're assigned to a specific hospital, you will be attending things like morning ICU rounds, interdisciplinary rounds, floor rounds. You might go to committee meetings like ethics committee or a transplant selection meeting. This is a committee that decides if someone gets listed for a certain type of transplant, and the committee focuses on one organ. So you have a committee that focuses on kidney or lung or heart, or add your organ here. And then, of course, there's one-on-one opportunities with healthcare professionals while they visit patients, also attend meetings, and really think about understanding ethics. So that can include physicians and nurses, but we also require students to go with chaplains and social workers and genetic counselors. So they're getting both depth and breadth across the rotation experience. On a weekly basis, students will meet for 1 hour with other students also rotating at the hospital, and led by a clinical ethicist or ethics committee member, and talk about the cases they saw, dive into the ethical issues, talk about the legal or um, hospital policies that influence decisions or affect decisions, talk about religious and cultural values, socioeconomic statuses, all these different things that go into a clinical ethics consult or a patient's case. Students will keep a log in a journal, and they'll write 2 ethical analyses of cases that they've seen throughout their time. I will say for students who are particularly interested in pre-med or pre-health, these rotations at 160 hours are really exciting for them, and it can count towards clinical shadowing for medical school applications, sometimes PA applications, and such. In terms of program outcomes, I would say kind of holistically, it definitely adds skill and knowledge to student applications, whether you're heading to medical school, law school, a PhD program, applying for jobs after the program. We definitely hear back from our students and our alums that when they go to interview for a medical school, for instance, or a residency, they get asked a lot about this degree because physicians, nurses, administrators see the value in having an understanding of clinical ethics, of ethics in the hospital setting, because they understand that it's not a matter of if a bioethics issue or a medical humanities issue comes up in patient care, it's when. As I mentioned earlier, this program does allow students for discernment, meaning they will have exposure to all different kinds of career paths and opportunities within the hospital and within the curriculum and research to really think about what a career path for them can look like, what career paths others have taken, and how to do that. And then lastly, we do have a vast network of alums in a variety of field and careers. What amazes me is I can easily send an email or a LinkedIn message to one of our alums and say, hey, I have a current student or someone who's about to graduate that would love to talk to you about your career path or your time in the program. Would you be willing to speak to them? I have yet to have an alum say no. They are so willing to talk to students because they understand the value that this program has offered them in their career path. So if you're interested in applying to the program, we do have an online application that we are taking for fall 2026. So you fill out the online application with a $50 application fee. We do need your transcripts from all undergrad or graduate institutions. Unofficial transcripts are fine for the purposes of your application submission. We ask for a CV or a resume, either format is fine. 2 letters of recommendation focusing on your abilities and your interest, and how well that letter writer knows you. We ask that one is some type of professor or instructor, preferably. A statement of purpose. So this is your opportunity to talk about your interest in bioethics and medical humanities and how you're hoping that this program can fit into your overall career path. It's also an opportunity to acknowledge any type of concerns that we may see on an application as well. Graduate test scores, whether it's a GRE, an MCAT, an LSAT, are entirely optional for the application. If you feel confident in the scores you received, you are welcome to submit it, but it is not required. If you're an international student, there may be additional requirements depending on where you earned your undergrad degree or equivalent degree. And then if you are a current case undergrad hoping to do this program as part of the combined bachelor's and master's, we do require a special form called the PPOS form that the student and I would meet together to fill out. In terms of finances, we do have something called student assistantships. It's an opportunity for students to get involved in teaching, research, or administrative roles within the department. And this opportunity gives students a partial tuition waiver in exchange for the work they're doing. So students may be involved in assisting with an undergrad bioethics or medical humanities course. You may get assigned to be a student ambassador or help organize activities that the department does, or maybe join a research project. Maybe you're going to help code or transcribe ongoing research. This is a highly competitive assistantship. I will say we generally get double or triple the number of applications in comparison to the slots we have available. But I would say on average, a student will receive around 7,000. That's split between the 2 semesters in tuition waiver. If you, to be eligible, you need to submit your master's application by May 15th. When you submit your master's application, you receive a email within 24 hours that has a link to the assistantship application, which needs to be submitted by June 1st. We also have more traditional routes of financial aid, which can be done and learned about through the financial aid office here at Case Western Reserve. In terms of timelines, so our next major deadline is our priority 2 deadline, which is May 15th. Again, if you're hoping to apply for an assistantship, you do need to submit your master's application by May 15th. The assistantship application is due June 1st. And our final deadline to accept master's applications is August 1st because we do start the program at the end of August. And we are an in-person program, and so students really need to give themselves enough time to move to Cleveland as well. We do rolling admissions, and so when you submit a completed application, meaning every material is included, including your letters of rec, we do rolling admissions. So within 2 to 3 weeks, we can typically render a admission decision for that applicant. Just a small highlight, Cleveland is a great city. I feel like sometimes it gets a bad rap and it has a stereotype, but Cleveland's cost of living is pretty reasonable by comparison to cities of similar size. But we also have amazing opportunities here in Cleveland outside of Case Western Reserve. So our Playhouse, our theater district is the largest theater district outside of Broadway in the country. We have the Cleveland Orchestra, which is highly ranked internationally. The Cleveland Art Museum is the second ranked freestanding art museum in the country. We have great sports teams. We have a great food scene in Little Italy and East 4th Street. And we have a wonderful Metro Park system throughout Cuyahoga County and Greater Cleveland. Whether you're interested in hiking or biking, in the wintertime, there's toboggan chutes. And we are only a 20-minute drive away from Cuyahoga Valley National Park as well. So I'm going to open it up for questions. You are welcome to submit a question here in the Q&A here in Zoom for those who are live, and others can submit questions to our email, bioethics@case.edu. I'm typically the one who checks that email. If you're also interested, you can scan this QR code and we can meet one-on-one to talk more about your specific interest in the program and whether this program is a good fit for you. So I'm looking to see if we have any questions submitted. So I often get the question of like, where do our alums go after the program? Excuse me. And I would say, most commonly, we have students who go on to medical school or law school, PhD programs. But to be more specific, we have students who go to programs at Ivy Leagues, Harvard, Yale, even things like Stanford, what's considered new Ivies, Case Western Reserve, other, universities, MD and DO programs, top tier law schools, very interesting PhD career paths, whether it is in bioethics, it could be a career path in sociology or medical anthropology, psychology, history, political science, philosophy. There's such a variety of doctoral programs that students go on to do. We also see students who go into public health or social work full time, and for those, they need a master's degree typically. And so it really is a variety of career paths that students go down, and being able to customize the curriculum really allows for that exploration and to reinforce their interest in their career path as well. Oh, this is a great question that was submitted. Do we need to specify a concentration of interest in our application? That is a great question. So if there is a concentration that you're interested in, you are welcome to include it in your statement of purpose. It gives us a little more insight, maybe into your interest in bioethics and medical humanities. But at no point during the application process are you required to commit to a concentration during the application process, or even when you choose to enroll in the program. You need to commit to a concentration when it comes time to register for courses, as you have to make sure you're registering for courses that are either required or the electives that count towards that concentration. So I would say discussing it in your application is a great opportunity. You could also discuss it in the interview process, but it is not required. That's a great question. So speaking of interview, we do interview every applicant for our program. Our goal is to interview them on Zoom to be the most accessible for students. And so it's generally a quick 30-minute, 20 to 30-minute interview, talking more about the application, interest in the program, but it also gives you an opportunity to ask your own questions as well. And I will say that interview process, what we're looking for in a student in kind of general sense is this idea of mutual fit. So not only are we looking at your application and thinking, is this student a good fit for our program, but we also want to ensure that our program is the right fit for the student. And so that interview process allows for us to get to know the applicant a little bit more than just a piece of paper or a file on the screen. And so we are very happy to interview everyone who applies to the program. So another great follow-up question regarding the application deadlines. So the master's, so I'm going to scroll back. If you are interested in applying to the assistantships, your master's application must be submitted by May 15th. The student assistantship application is due on June 1st. So I would focus first on the master's application. Make sure you submit by May 15th. Whenever you submit it up until May 15th, within 24 hours, you will receive the link to apply for the student assistantships. That second application, that assistantship application, is due June 1st. Great question. Thank you for having me clarify it. I will say on the assistantship application, it's more in terms of, it's very practical questions. So between teaching, research, or admin, what is your interest? Do you have teaching experience? What is it? Do you have research experience or administrative experience? We do ask for a letter of interest regarding these assistantships specifically. And we think about both merit and financial need for our assistantship. So one does not necessarily rank higher than the other. And then we do ask for a letter of recommendation in the assistantship application. So we only require 2 letters for our master's application, but then we would require a 3rd letter essentially for the assistantship. So great question. Thank you so much for asking me to clarify that. All right. We are at time. I'm not seeing any other questions other than, yes, this recording will be available online. We'll post it probably within about 24 hours on our YouTube channel. Hi to those who are watching the recording now. And I'm happy to meet with anyone who's interested in learning more about the program. You are welcome to email us, bioethics@case.edu. I'm pretty good at checking that email on a regular basis and getting back to students in a timely manner. And you can, or you can schedule a one-on-one meeting with me. I'm also happy to send you the link in an email to schedule a time. So I hope this webinar was helpful in terms of learning more about our master's program and clinical ethics. I hope you consider submitting a master's application for us and potentially joining us this fall. So thank you so much to everyone, and I hope you have a good rest of your day.